I just want to make sure that everyone could see my slides. So I assume everybody could see my slides. Great. Okay. Okay. Next slide, please. Can we do next slide, please? Hi, Kathy. I'm not sure if you on your end also have a frozen slide. It's not moving to the next slide. Do you want me to see if I can share? Okay, there we go. So as far as disclosures go, I have no financial sponsors. I have delivered similar types of talks to other conferences for a small honorarium. Next slide, please. Our learning objectives today are to identify when to take an environmental exposure history and recognize the most susceptible groups, as well as recognize common sources of environmental exposures and the potential impacts on health, to summarize the components of an environmental exposure history with possible approaches and assessment tools, and apply the SEAM approach, which I came up with, as well as the CHOPT tool for taking an environmental exposure history in a case study. Next slide, please. So the problem, there are many toxicants in our everyday lives, from fossil fuels, gasoline, fuel additives, flame retardants, food additives, perfumes, pesticides, plastics, etc. So with these widely disseminated pollutants in our environment, one has to consider the possibility of their effects on health. Next slide, please. So what? We have a lot of these pollutants in the environment. What are their health effects? Sorry, if you can please go. Yes, thank you. We know from the literature, there's a lot of different effects on health, from the respiratory system to the reproductive system to systemic symptoms and diseases such as cancer. And even at low-level exposures to multiple chemicals, there's reason to be concerned about possible health consequences. Next slide, please. So according to the World Health Organization, an estimated 24% of all global deaths are linked to the environment. That's 3.2 million deaths per year from indoor smoke from cooking fuels, 4.2 million deaths per year from outdoor air pollution, such as fine particulate matter, and many other health issues. Next slide, please. So this graph represents the environmental fraction of burden of selected diseases that was reported in the Journal of Public Health in 2017 by Prus-Ustin et al. In this study, they estimated that the global burden of common diseases attributable to environmental determinants in 2012 were as shown in this graph. We can see that there's a fairly large percentage of many of these common conditions are due to unhealthy environments. However, because hazardous environmental exposures are usually not considered in the differential diagnosis, we often miss the opportunity to intervene with preventative measures. Therefore, it's important that healthcare professionals learn about these environmental risk factors or triggers of disease and how to counsel their patients about prevention and management. Next slide, please. So public health agencies such as Public Health Ontario have for years now reported on the environmental burden on various health issues, including cancer and other health impacts related to air, water, and soil pollution. Yet, despite all the scientific reports in the literature, there's still insufficient medical education about the health effects related to these common environmental toxins. Next slide, please. Furthermore, out of the many thousands of synthetic chemicals in use in our everyday lives, only a small fraction of these have been tested for safety to humans. The 2016 chemical data reporting to the EPA showed that over 8,000 chemicals were used in commerce. And out of the 80,000 chemicals that have ever been registered, only about 1% of these have undergone testing for human safety. The EPA in the United States and SEPA in Canada are evaluating a small percentage of these chemicals on a yearly basis. Next slide, please. So what are some of the barriers to not having an environmental exposure history in place already? Well, in addition to the time needed to take an environmental exposure history, other barriers may include the difficulty in quantifying the burden of morbidity or mortality related to environmental exposures due to multifactorial etiology of many diseases, as well as maybe the poor compliance with reporting and perhaps the absence of reporting systems. I would say primarily the absence of reporting systems for environmentally related diseases is another barrier. Next slide, please. So what is an environmental exposure? The definition as given in the citation seen below is environmental exposures having contact with chemical, biological, or physical substances found in air, water, food, or soil that may have harmful effect on a person's health. Next slide, please. So why take an environmental exposure history? Well, an exposure history provides clues that prompt an investigation for possible toxic exposure. As most environmental exposures or diseases manifest with common medical problems do, they're often, non-specific symptoms, and therefore the etiology is often missed. So unless an exposure history is pursued, the diagnosis and the treatment may not be appropriate, and the exposure may continue. Next slide, please. So I asked the audience in these situations, in which one would you take an environmental exposure history? Which one do you think is the most important one out of these conditions to take an environmental exposure history? You could just put a letter, if you're able to put a letter or say out loud A, B, C, or D, F. And since I can't see the answers, maybe Kathy, if you have an answer there that you can see.
Right now, I'm still waiting.
Okay. And I'll read out the options in case someone cannot see them. So A is chronic health conditions such as asthma. B is acute or recurrent symptoms such as migraines. C is preconception or prenatal period. D is occupationally related health conditions. E is otherwise unexplained illnesses. And F, on every patient, as many organ systems are affected by toxic exposures.
So Dr. Sohi's put F.
Okay. All right. So I agree. And even these above conditions from A to E are some red flags that would prompt even further an environmental exposure history. Often there's many other conditions that are affected by environmental exposure. So having one on everyone would be actually help um, with diagnostic and preventative measures. So let's move on to the next slide. So here we see organ systems that are often affected by toxic exposure. This the contents of this was adapted from the ATSDR website, CDC's ATSDR website, and as you can see, the, from respiratory to neurologic to hematologic, like all organ systems can be affected by various toxins. And for example, the respiratory system can be both an entry of toxicants as well as have effects from toxicants, such as adult onset asthma. And out of many hundreds of toxicants that cause asthma, it's often difficult to say which one it is that would do it, but having a good exposure history would help determine that. As well, for example, there's many thousands of cases of renal disease where we don't know what the cause of the disease is. And we know that organic solvents and heavy metals are also toxicants that are known to affect renal function. And similarly, neurotoxicants can cause peripheral neuropathy, such as ataxia, Parkinsonism, seizures, etc. Next slide, please. And here we have some examples of environmental and occupational causes of medical problems. As mentioned before, conditions such as asthma, also angina, hepatitis, peripheral neuropathy, behavioral changes. These are just some examples. And some of the agents, this is by no means an exhaustive list of agents that can cause these problems. And some examples of how one might be exposed. And again, there's many other ways people can be exposed. These are just some examples. Next slide, please. So who is the most vulnerable to environmental health hazards? Here are, number of groups that are generally considered to be more predisposed to the effects of their environment. And probably on here should probably be also people living in, poverty and in unsanitary conditions. Anyway, despite the vast amounts of chemicals in the environment, relatively few household or environmental chemicals that are commonly used, for children and adults alike. Very few of them have undergone adequate screening for their potential cause of harm to children in particular. There's a group in the United States called the Pediatric Environmental Health Specialty Unit, or PESU, which is a North American network of academically based medical experts in children's environmental health. And they're a great source of information for healthcare professionals, as well as parents and child caregivers. If anyone wishes to find out more about how environmental toxicants affect children's health, that's a very good source. Next slide, please. And here are some examples of genetic factors that give increased susceptibility to environmental chemicals. For example, having a glucose 6-phosphate dehydrogenase deficiency, which occurs in about 12% of African American males, and this particular predisposing factor increases the impact of oxidizing chemicals. There's other conditions such as methemoglobin reductase deficiency, which is about 1% of the population. And this predisposes to increased susceptibility to nitrites, and other genetic factors like slow acetylator phenotypes, which is fairly common, and this increases susceptibility to aromatic amine-induced cancers. Again, these are just some examples, and of course, this is not an exhaustive list, and there's probably a lot more that we don't know about. Next slide, please. So here is just like a snapshot of some hazardous substances in the environment, the potential exposure pathway, and the systems affected, such as lead, arsenic, mercury, cadmium, benzene, vinyl chloride. Each of these have a way that they normally enter the body, and the main ways that these pollutants can enter the body are inhalation or ingestion, but sometimes they can also enter via the skin, so topically. Next slide, please. So how to take an environmental exposure history, and I'm going to talk about a couple of approaches. So in the literature from more than 2 decades ago, some of my colleagues have written about and come up with a mnemonic or a tool called CHOPPED, which stands for community, home, hobbies, occupation, personal, diet, and drugs. And this is the one I often use when I take an environmental exposure history at the environmental health clinic at Women's College Hospital. Another one that I came across was one that is used with occupational health nurses called I Prepare. And the one that I developed myself is the SEAM approach, which I will discuss in a moment. And I also use the 4 Ps to remember the common toxicant groups, the 4 Ps being petrochemicals, pesticides, plastics, and perfumes, and the 4 Is for the routes of exposure, which are inhalation, ingestion, integument, and invisible. Next slide, please. So typically, again, we use this CHOPPED formula to do an environmental exposure history, and further information on this, as well as case studies, have been written up using this from Marshall et al. And the references will be at the end if anyone wants to read some of the old case studies from over 20 years ago. Next slide, please. So environmental exposure history includes questions such as the home locations, the present as well as previous, school setting for children especially, what occupation the household members are doing, how you heat or cool your home, pesticides, they're used either cosmetically or other for occupation, what's the drinking water source, if there's been any recent renovations, hobbies, hazardous waste spills in the area, the ventilation in the home, if there's been any like flooding or moisture issues, and the food sources. These are just some of the categories or areas to consider when taking an environmental exposure history. Next slide, please. Actually, this is an example that I referred to earlier by Marshall et al. From 2002. And this was a series that was presented in the Family Physicians Journal. So here you can see how the CHOP formula was used, where they took an exposure history. It could be as brief as this one that you see right here, or much more detailed. So in this situation, asking questions about hazardous waste, about the home, how old is it is, and other questions, as you can see. Next slide, please. In the occupational world, it is important to ask about the occupation and whether or not the patient has been exposed to any toxic agents. If the patient is regularly in contact with these possible agents, they should know about the material safety and data sheet, which is an information that must be provided by law and, to include the product information, um, the physical information of the product, as well as the toxicological properties of whatever is being used in the workplace. So this should be made available by workers, and clinicians could also access this information if they want to help figure out if their patients are being affected uh, by a substance. Next slide, please. So in taking an environmental exposure history for a child, we could use a similar mnemonic to the one that we had earlier, which was the CHOP mnemonic. And from the pediatric websites, this is the one that I found, which was at CHEW, standing for activities, community, household, hobbies, occupation of parent, and oral behaviors. And there's different questions you can ask in each category. Next slide, please. And here is an example from a very useful website that I found called NEEF. And I believe that stands for National, actually, I don't know. Here it is. Here it is. National Environment Education Foundation website. And this had a full, I believe it was 6 pages long pediatric environmental history for 0 to 18 years of age. I just took a snapshot here of the first section of the screening environmental history. And a lot of people have advocated that maybe we should be having such an environmental history for all children, and start early with identifying potential environmental hazards. So if you'd like to see the PDF form, it's a fillable PDF form. The resources provided, I can provide either in the chat later, we can provide the resource, or I think it should show up in the references later on. Next slide, please. However, if you didn't have that one handy, the chopped formula works just fine, even for the pediatric situation. As an example here, was taken, and you can go to this reference to see how they did the history, taking, obviously you have to know about the parents, for example, knowing the occupation of the parents, knowing the diet that's being followed, and if there's any drugs or medications that are being taken by the parent, if there's breastfeeding, or by the child. Next slide, please. And this is the iPrepare mnemonic that helps with addressing when determining environmental exposure risk factors or other environmental exposures. So this is another one that nurses have used in occupational settings, and maybe a good reference if anybody would like to look at that one. Next slide, please. Here's just a snapshot of that iPrepare environmental exposure history assessment tool. It's very hard to read, but if you see it, if you refer to it online, you can see all the questions that are asked in each of these categories. So with the first one being investigating potential exposures, to the last one being education about the exposures. Next slide, please. And are some examples of an environmental and occupational causes of medical problems. This is taken from an article from Nursing Spectrum 1998. You can see how old this information is. It's not new information. In fact, there's very little written about how to take an environmental exposure history in the last 20 years. So hopefully we can update this information and maybe include more. But here are some of the medical problems that are associated with environmental exposures, anything from headache to even psychosis. Next slide, please. So here are some of the organ systems often affected by toxic exposure. And you can see heart rate, blood pressure, anemia, leukemia, many organ systems can be affected. Next slide, please. And here are some commonly used compounds that can have serious effects on health. And as this is just a little tiny snapshot of some of the examples. And these are common day to day. For example, the paradichlorobenzene that is used in air fresheners, toilet bowl deodorizers, etc. Actually, I was going to mention a common one that we are often exposed to, we don't usually see, but small amounts of organophosphate pesticides on vegetables and fruit. This is sometimes more problematic when there's large exposures, if you're living in an area that this is being used as a pesticides in the field, and can cause, especially if there's in children who are closer to the ground, they're more likely to be affected by exposures if there's been any spraying of pesticides. And there are tests that can be done to determine if there is an elevated exposure. But again, this goes into more details, which hopefully in the future we can talk about more specifics. Next slide, please. So this is the mnemonic that I've kind of come up with over the years to kind of help with the approach. It's actually more of an approach for environmental issues, and that's the SEAM approach. So I look at when I suspect an environmental cause to an illness, I look at the possible source of the toxicant that I'm considering. So, and in determining what is the source, I do use the chopped mnemonic to take that history and figure out what sources of exposure there are. And then for the effects on health, if I do have a suspect chemical, I will look that up. I don't know all the chemical effects, then I often have to use resources. And a very good source of that is the ATSDR, which we'll put up again at the end. They actually have very good 2-pagers, which describe various chemicals and their health effects. Then for assessment, I do a physical exam, of course. Sometimes I order general lab tests, and on occasion, more rare, I do special tests. Often there's no special tests in the chronic setting for toxicant exposure. Generally speaking, not even the acute exposures are very easy to get specific tests on. When you're exposed to something, usually you should be testing that right away. And usually either blood or urine tests. And then M for manage. A lot of the times, much of what I do is I educate, advise, generally either avoidance or reduction of exposures, and how to mitigate the exposures with beneficial things such as diet. And a lot of the times I'm also advocating and writing letters for my patients in order to help them decrease their exposures, for example, at work. Next slide, please. Okay, so here we have a case study, and it's a fictitious case study, but I just came up with it based on some of the snippets of information that we know about benzene. So here we have Ben. He's a 44-year-old male who complains of fatigue and frequent nosebleeds, as well as easy bruising in the past 6 months. He's noted that he's had about a 10-pound weight loss, decreased appetite, but he denies any bloody or black stools. Apart from frequent long-lasting colds in the past 18 months and increased fatigue, his past medical history is negative. He denies smoking or any recreational drug use, and he only has about 2 bottles of beer on the weekend. Apart from the occasional use of acetaminophen and for cold symptoms, he denies any regular medications, and he has no known allergies. So I take an environmental exposure history using the approach I mentioned before, and I find out that Ben lives in a transitional part of the city, close to an industry and major roads and a railway track. He lives in an old house that's heated by oil furnace, and that he has partly renovated his house himself. His hobbies include fixing cars, but he's also an avid cyclist. And his work requires that he drives long distances, and he's often stuck in traffic. So I examined Ben, and on exam, he appears thin with skin and conjunctival pallor. He has at least a dozen petechiae on his arms and some bruises on both arms and legs. His blood pressure is 124/78. His heart rate is 92 beats per minute at rest. His throat shows crescent erythema without exudate, and his cervical lymph nodes are mildly enlarged but rubbery in consistency bilaterally. I did a few tests, and in those tests, I determined that, or I see that his labs show mild anemia, mild leukopenia, and mild thrombocytopenia. His hemoglobin electrophoresis is normal, and his iron, folate, and B12 levels are also normal. I do a stool test for him, and his blood, that's negative, there's no blood. And the chest x-ray is also normal. So in thinking about this case, let's go to the next slide and see if we can figure this out together. I'm not sure how many people are on the call today or on the webinar today, but if you would like to either verbally kind of think about each of these out loud, or if you want to write in the chat what you think. Now we'll go one by one. We'll start with the sources. What are the sources of benzene? And then we'll talk about what are the possible health effects of exposure to benzene, and how can we assess, as well as how we can manage. Does anybody have any thoughts about the first one, about sources?
There's only a small group, so just go ahead and unmute yourselves.
I think it was organic chemicals and maybe pesticides, since paint, was it paint remover or paint stripper?
For sources of benzene, there's so many sources of benzene. I wouldn't be surprised if those are one of them that might, but I'm thinking more common, everyday, day-to-day exposure of benzene. And thinking about the case, I don't know if we want to go back one slide about this person's case and what his possible sources are. Maybe if you want to go back one slide. Yeah, so looking at this person's work, what he does for hobbies, where he lives, what there stands out as a possible common source of benzene? And by the way, benzene is a fuel additive. And it's just in my mind, I consider benzene a token chemical. The reason I consider it a token chemical is because there are many other chemicals involved in the combustion of fossil fuels. And benzene is a fuel additive. So by law, at least in Canada and the US, there shouldn't be more than, I believe, 1% of the fuel, not more than 1% should have benzene as an additive. So it's
So he's
yeah.
inhalation, because he lives near factories, the railway tracks, and then he's using he had some sort of furnace or something there. It's burning for his heat.
That's right. That's right. Yeah. Yeah. So Ben has multiple exposure sources here. His home, not only inside his home, how he heats his home, but where he lives, like near the major roads. He also has a hobby that exposes him as well with fixing cars and stuff. So, and he's often stuck in that traffic because he drives a lot, and that's a major source for a major, source of this exposure. Okay, so that's for source. Now, let's move on to the next slide. And maybe the next one as well. So as you can see, many sources of benzene: tobacco smoke, motor vehicle exhaust, industrial emissions, glues, paints, gas stations. So you mentioned paint strippers, I think. So I think paints and paint strippers can have it, not all of them, but some of them. Gas stations, styrofoam products, food, some foods actually have a very small, tiny quantity. Rubbers, lubricants, and therefore, as mentioned, you can be exposed via inhalation. Ingestion is another. Well, actually, ingestion is not as common, but yes, you can get it through foods. And then the dermal route, which is the least common, but the most common is inhalation, as mentioned. Next slide, please. And I don't expect everyone to know this, so that's why there might be other health effects, but very commonly benzene has an effect on the bone marrow in the making of blood cells. So, when we think about the effects on health, we want to know if there's been an acute high-level inhalation exposure, which can cause rapid heart rate. That can cause effects on the heart rate. Depending on how much you're exposed to, it can cause unconsciousness and even death if you're exposed to a really high amount. An acute ingestion exposure can cause vomiting, convulsions, and possibly death at a very large amount. And a chronic exposure, even if it's like not as high level as an acute exposure, but like a daily exposure, can cause anemia, or thrombocytopenia, low platelets, and leukopenia, low white blood cells. So we also know that benzene is a carcinogen, and it can cause cancers such as AML, and it's harmful to the nervous system. It can cause drowsiness, headache, confusion. Actually, this might be the most common effect that people may not recognize. So, if you're feeling kind of drowsy while driving a car long distances and you're inhaling the benzene, you do get a small exposure of benzene while you're driving your car coming through the vents. And depending on how much time you spend in your car, you might be exposed to more than would be considered safe. And the immune system, of course, can be affected. So when you do have decreased white blood cells, that can put you at increased risk for infection. And then aplastic anemia, that would be a possible cause. And it's a solvent. Benzene is a solvent, so it does have an affinity for fatty tissues in your body. So some of it, of course, you excrete or your body gets rid of, but sometimes some of it your body doesn't, and it ends up getting stored in fat. Next slide, please. So what do you do when you have an exposure to something that's toxic? Well, you're going to do some assessments, just as you would for any other health issues. You're going to assess. In this situation, I assessed the blood. Sometimes in very odd situations for work, breath tests can be done. But that's, I don't know of too many places that end up testing the breath for benzene, but it's only detectable if there's been a very recent acute exposure. Similarly, urine metabolites, by the time I see anybody, urine metabolites won't show anything unless they're still being exposed to relatively higher levels. So urine metabolites may not even be available at your local lab. You may have to outsource it, but they can detect like higher exposures if done shortly afterward. So what I have left usually is doing things like the CBC analysis, which may show in this situation showed anemia, leukopenia, thrombocytopenia, and I've ruled out other causes of these problems such as nutritional deficiencies. And if this person, I take them and I say, look, try and avoid all your benzene exposure and let's see what happens. We retest your blood, and if you've avoided this and your blood goes back to normal, great. But if it doesn't, hematology referrals definitely warranted to rule out megaloblastic anemia. Next slide, please. So again, management would be, I would advise on reducing, if not avoiding, continued exposure. And this is often very difficult to do because most people cannot change their home or where they live or their job. And so, but generally speaking, I would advise them to reduce their exposure as much as they can. Now, there are regulations out there, as I mentioned, in the United States, they regulate how much benzene can be in drinking water, for example, not more than 5 parts per billion. OSHA regulates workers and states that, the exposure limit is only 1 part per million for an 8-hour time-weighted average workday. But honestly, I'm not sure if that's even usually measured, but that's the regulation according to OSHA. And CIPA, which is an outdated Canadian regulations, prohibits supply of gasoline that contains benzene at a concentration exceeding 1% by volume. I'm not sure if this is going to be changed anytime soon, but hopefully it does, because just like lead, there's no safe exposure. Hopefully they'll realize benzene, there's probably no real safe exposure either. Next slide, please. And by the way, if anybody has any questions, I forgot to say, you can either jump in or maybe save it to the end. This is the tox guide. I highly recommend this as a resource for any clinician, because it's fast and easy read. There's, you can get really bogged down with learning about environmental toxicants and, really long, reading, but this one's not long reading. So this is where I would say if anybody wants to start off with something manageable, little snapshots, even you can print it out for yourself, or maybe a patient if you had a situation. For example, here, this is a Tox Guide for benzene. At this website, there's many other ones for many other chemicals as well. I think they have one for all the heavy metals, as well as yeah, there's other solvents such as styrene, toluene, etc. So because benzene plays such a vital role in many industrial processes and it's a component of gasoline, it's very widespread in the environment. If you drink alcohol or take other drugs, it does induce the mixed function oxidase enzymes, which may potentiate the effects of benzene. It affects the CNS, the central nervous system, as well as the hematopoietic system. And all three blood cell lines may be adversely affected by benzene. An acute exposure, as mentioned, can cause CNS depression. Symptoms of chronic benzene exposure may be nonspecific, such as fatigue or anorexia. The mean corpuscular volume and lymphocyte count may aid in the diagnosis of toxicity to benzene. And then once chronic exposure to benzene stops, the hematologic tests typically return to normal. However, if they don't, a referral to hematology is warranted for a bone marrow aspiration and biopsy. Next slide, please. So here are just some referrals and resources that you could look at. We're at the Environmental Health Clinic at Women's College Hospital. You could refer any patients to us. However, the warning is we do have a long wait list. It's 2 years wait now, actually more than 2 years. Now, there's also the Association of Occupational Environmental Clinics in Ontario for workers. There's any acute exposures that you want to find out, how is this affecting my patient? You can call the Ontario Poison Center. If it's work related, the CCOHS Safety Info Line. You can actually obtain. You can actually, if you don't have it available at your work easily, you can find out more about the MSTS sheets at this website. And then there's also a little pocket guide that NIOSH has for chemical hazards, and the ATSDR, like the tox guides that I just showed. Next slide, please. Now, here's the website for the Association of Occupational and Environmental Clinics, which there's like a scattered handful throughout Canada and more in the US. Next slide, please. So conclusions. The purpose of environmental exposure history is to recognize and manage preventable environmental causes or contributors to health problems and diseases. The components of the history include the community, housing, hobbies, occupation, personal products, diet, and drugs. Everyone is exposed to common sources of environmental exposures, and these can have various health effects, especially in the more vulnerable populations. And these include fetus, children, elderly, certain genetic predispositions, and pre-existing conditions. Taking an environmental exposure history can be focused or detailed, especially if you have more complex cases. And this may require more time. With increased education and practice, clinicians can play an important role in detecting, treating, and preventing disease resulting from toxic environmental exposures. And expertise in toxicology is not required to take a good environmental exposure history. However, having a good approach and example questions will help. And there's various resources that exist that can help with this, including the ATSDR, PESU, the Material Safety Data Sheet, OCAL, and our clinic. And I hope this discussion has illustrated the importance of taking an environmental exposure history and inspired you to learn more. Next slide, please. I like this quote. This quote is from a sewing book, Anatomy of a Seam by Eileen Fisher. And when it comes to seams, a whole lot is riding on a single thread. And I think that's how I consider health effects related to environmental exposures. Next slide, please. There's many references, and I'm sorry you can't see these because there's so many of them. And next slide, please. But if you do want to learn more, I highly recommend ATSDR and the talks guides that I mentioned earlier, but these are some of my other resources that I used. Next slide, please. So thank you very much, everyone, for your attention. And here's my contact email if you needed to get a hold of me. If you have any questions, I'd be happy to answer.
If anyone has a question, just go ahead and unmute yourselves.
I think there might be something in the chat. I'm not
Okay,
sure.
thank you very much, Doctor.
Thank you.
For this excellent presentation. I didn't even know that there's so many things that that it really affected. So very important, as you said, to take a comprehensive history.
Yeah. Thank you. Did you have were there any concerns about or questions about the environmental history and any barriers that you see with doing that?
I believe that there is the barrier is not insurmountable if the significance of this issue is recognized and adopted by physicians, because it's just a matter of just asking an additional question or two. And the one that really caught my eye is the one about the neonatals and the newborns. How common is that?
How common is what? Sorry, I missed a
The
word there.
environmental impact on fetuses and the
Yes.
yeah.
Good question.
During how does and which types of chemicals or are they affected by the most?
Good. Yes, good question. And this is where we don't have probably enough data to be able to answer that question. I mean, there's a lot of obviously research that has been done with so many different things that have affected, had adverse outcomes on children. But honestly, like if we're not doing an exposure history on everyone or a lot of people, it's hard to quantify exactly how many of these health problems are related to environmental exposures. This is the point I was making earlier in the discussion, is that if we don't do an environmental exposure history, those exposures, like the cause or the etiology gets missed. We miss preventable causes. So, when I was reviewing when I was doing a study on pediatric cancer and I was reviewing charts, these charts did not have an environmental, these children who had cancer, these charts did not have environmental exposure history. And these children are having cancer at a very young age. What's their exposure? They're not smokers. They're not doing any of these bad things. So the exposures probably would have been either preconception or during, fetal life, or maybe in early childhood. And it would have been in their community maybe their home, maternal, paternal, occupations. Like there have been studies on occupations of parents who've had these types of cancers, and they do show like risks, increased risk with exposures to certain chemicals, including benzene. We know that from the literature from many, many, many years ago, benzene is a carcinogen. To give an actual number is really difficult unless you do an exposure history on all children, for example. And I'm giving you just one example here. If we don't do an exposure history on all children, we can't possibly give a specific number. But according to the World Health Organization, about a quarter of health issues are related to the environment.
Thank you.
You're welcome.
There's nothing in the chat, but does anyone else have a
Yes,
question?
just
Oh,
maybe.
sorry. Dr. Sohi just put something. Barriers that come to my mind would be the coverage of tests and oftentimes not knowing what exactly to order / put on the lab rec.
Yes, absolutely. Absolutely. That's my barrier too. Sometimes I look, like, for example, I might use some of those resources that I mentioned, and I see that there's, like, for example, a urine test for a metabolic byproduct of that chemical, and I want to test it, but I can't, because I go to my lab, or I ask the lab where I work, do you do this test? And often they don't. So we're stuck sometimes. And so that's where I would say, use what you can, use what's available. In general, blood work like CBC is available. So that can provide some clues. Just considering the possibility is also important. Like if you don't consider it, you can never spot it out, right? So like if there's no other potential reason why that person has the problem, but then you do an exposure history, you find out, okay, there is a potential, reason that you have this problem, then you at least get like a start on it. And you can refer to specialists. If it's occupational related, you can refer to an occupational specialist. You can refer to us if it's more an environmental related. And we do very long histories. Like I don't expect like people who are not doing this regularly to do a really long history. A brief history might be what you can do, and then refer to us. Now it is a 2-year wait list, but hopefully we'll have something in place in the future where it would be much more like, a widespread, use of an environmental exposure history. So yeah, no, I agree that what do you order? I have that problem too, but use what you have, and if you have any need for more in-depth assessment, refer. And then I think there's another comment from someone. I can't read it because it's very long font.
No, it's okay. It's she just said thank you. Any other questions?
I think I see another comment by somebody, Michaela.
No, she just put F. That was in reference to your.
Okay. Yes.
question.
Yes. Asthma is a very common, like that one's a very big one related to environmental exposure. There's like hundreds of potential triggers, like toxic triggers in our air that trigger asthma. Yeah, as well as allergies, of course. Keeping the dust low. There's obviously overlap. So I often advise my patients who are having effects from, chemicals in the environment that to also keep the dust levels low, because a lot of these chemicals, they hang out with the dust. They're on the dust. So the patients are inhaling dust and these other chemicals that are all both triggering the asthma. So keeping the dust levels low, using a wet mop to remove dust. High efficient, the HVAC using like a filter that filters out the air. Asthma Society approved filters would really help in a home to reduce the particulates. Thank you.
Okay, not seeing any other comments, not seeing anyone unmute themselves, so I think we'll wrap it up. Thank you very much, Dr. Tambasco. And you are coming back in March to present on multiple sensitivities. That'll be March 17th. So watch for the upcoming poster to be released soon. And just a reminder, we have Dr. Michelle Gordon next week presenting to our team. And yeah, that's it. Thank you very much.
Thank you. Bye-bye, everyone.